So my name is Lucky. I'm going to be talking to you guys about H1N1. Does anybody know what H1N1 stands for? Is relative to?
No.
No.
Eric?
Swine flu?
Very good. That's what we're going to be talking about, okay? Go ahead, next slide, please. So the origin of influenza, which was back in 1918, Spanish flu, and it comes also from Asian flu, Hong Kong, and towards swine flu in this era. Asian flu and Hong Kong flu is close to the bird influenza back then, so lots of people died from that. So let's go to the next one. Okay, what is swine flu? So respiratory disease caused by a virus that infects respiratory tract of pigs. Humans who work closely with them develop it, and H1N1 flu viruses are not transmitted through food. So if you were to eat a pig that was infected by the H1N1, you would not get it. Okay. So next slide, please. So the first case of H1N1 was actually near here in San Diego. It was in Mexico, close to TJ, and pretty much this was patients who had worked with farm pigs in their farm, and they also contacted the H1N1 flu. Okay, next slide. How influenza affects humans. There are three main types, A, B, and C. The virus particle attached to the living cell injects the genetic material into it. It gets into your RNA and your DNA, and then the cell then bursts hundreds of virus particles, and it also repeats the whole cycle. The next slide is actually a visual slide of how it works. Go to the next slide. And so this is when the virus comes into the body, enters to the cell, releasing the RNA, and the virus invades the RNA, and so on, and destroying the cell, and goes into the rest of your body. Go ahead, next slide, please. So how the virus works in your body. The virus enters the body through your nose, into your airways and lungs, and it attaches to your airways walls. The patient then starts to hunt out and clear the virus from the body, leading to recovery, but if too many cells in the lungs are destroyed, it can get the patient really sick if it's not caught in time. Go ahead, next slide. The symptoms are systematic fever, runny nose, sore throat, diarrhea, lethargy, lack of appetite, coughing, and nausea and vomiting. Next slide. Diagnostic tests. There are two diagnostic tests. One is the typical swab in your nasopharyngeal, and also the diagnostic rapid response test, which is this one that pretty much ER does right when you get in there, and if you have those symptoms, they will have you take it. This slide talks about immunization, both approved by CDC, which is the shots vaccine, and also your nasal spray, mostly used for younger patients. Go ahead, next slide. Oh, yes.
The,
You have a
the
question?
CDC, that's the Center for Disease and Control.
Yes.
Thank you.
Welcome. Next slide. There are treatments, medical-wise, reported from CDC to prevent swine flu, the Relenza and the Tamiflu. One is a inhaler, and the other is pill form. Next slide. And the modes of transmission of H1N1. Mostly respiratory droplets when someone sneezes or cough in front of you. So if you do have a little cough here and there, try to wash your hands or cover your mouth if possible. Next slide. How to protect yourself from others. Like I said, wash your hands, cover your mouth. Try not to be around people who has H1N1, or if you do have those symptoms, try not to be around people who is not sick with it. Next slide. Okay, next slide. What is the conclusion? It is never late to have a flu shot. If you feel like you haven't gotten it, go ahead and take it. It is close to any pharmacy area or your near medical office with your doctor. So that is my speech for persuading people to get into your flu shots. Any questions?
No.
Okay, that's it. Thank you.
Thank you.
Yay.
Did you record? I hope you did.